Congratulations on purchasing the latest concept in lumbar spine treatment, the Vertetrac. Offering safe, simple, compact, and effective treatment of lumbar spine disorders, the Vertetrac brings to both the patient and physician a means of powerful dynamic traction and simultaneous three-dimensional action without the need for traction beds or restrictive braces. Begin with the Vertetrac in the 0 position by inverting the Vertetrac unit on a horizontal surface and pressing the traction release levers and bringing the upper frame and lower frame to their closest possible position. Retract the horizontal pressure pad fully by depressing the screw release button and pulling the horizontal force screw. Place the Vertetrac on the patient's body. With the patient holding the lower frame, place it directly above the iliac crests, pelvis, with the horizontal force screw centered behind the spine. When the Vertetrac is properly positioned, fasten the lower belt fastener and begin tightening the lower ratchet so that the ratchet rests loosely in the middle of the patient's body. Tighten the belt by moving the ratchet handle in a left-to-right motion, repeating until the appropriate amount of tension has been applied. Do the same for the upper belt fastener. The upper frame should fit around the patient's rib cage with no clothing, body parts, or other obstructions between the frame and the rib cage. Please note that when treating large-breasted patients, the patient's breasts should be resting above the upper frame and not trapped between the frame and the body. Begin adjusting the lower belt so that it fits tightly around the body. The lower belt should be sufficiently tight to prevent slipping of the apparatus during the treatment. It is recommended to center the ratchet horizontally on the belt, but this position may be changed as different patients may require a different position. Tightening of the upper belt should ensure that the upper frame is well pressed against the body so that no space remains between the upper frame and the skin. Apply lumbar traction by simultaneously jacking both traction levers at a consistent rate until the skin is tightly stretched between the upper and lower frames and there is considerable resistance to the movements of the handles. The skin below the upper frame should be taut so that it cannot be caught between the fingers. The skin above the upper frame should be folded. When horizontal force is recommended, place and adjust forward the horizontal force pad at the desired level, L3, L4, or L5. Apply horizontal force by turning the horizontal pressure screw clockwise to the point where the patient feels relief from leg pain. When asymmetrical traction is recommended, apply simultaneous traction to the point where the patient feels a moderate traction force and then apply additional traction on the appropriate side. It is recommended for the patient to walk freely in the room or participate in active exercises during the treatment session, for example, on a treadmill or using elastic bands. To loosen the belt, pull the ratchet lever as far to the right as possible while lifting the U-shaped retaining clip. The patient should be instructed in the proper and safe use of the Vertetrac. Once the patient is comfortable with the use and maintenance of the unit, the patient, according to his medical condition, may begin performing self-treatment. The patient should follow a treatment schedule outlined by the physician. Long-term patients should be examined monthly by the physician in order to gauge the patient's condition and the improvement accomplished. Use the comfort pads if the patient feels excessive pressure beneath the sternum or on ribs or iliac crests. For small-bodied patients, it may be necessary to use the comfort pads in order to allow the upper and lower frames to be tightened sufficiently. In very small or sensitive body patients, we recommend using a soft towel around the waist. When the ratchet was not fastened properly and is close to the buckle, use a long and narrow tool, screwdriver or dull knife, push the metal plate against the spring. While pushing the metal plate, in U-shape inside, raise the plastic cover and release the belt. When the ratchet lever is locked in the open position, 180 degrees, the ratchet can slide from side to side on the belt. Unlock the ratchet lever by pulling on the retaining clip in the ratchet handle and partially closing the handle. In case the patient feels discomfort, open immediately the upper and lower black.